In 1999, Monique "Nikki" White had graduated from the University of Texas with a degree in psychology and was gainfully employed when she was diagnosed with lupus. It was a tough turn of events, but not fatal. About 80% of lupus sufferers live out a normal lifespan, the 80% who have health insurance. Before long, Nikki became so ill that she had to leave her job, and with it, her health insurance. Lupus was not a death sentence, but loss of health insurance was. Due to her pre-existing condition, no other insurer would pick her up. She had too much money to qualify for Medicaid and too little to afford private medical care. "I don't want to die," she wrote to insurance companies and government programs. "Please, don't let me die." Eventually, she became sick and poor enough to secure subsidized medical care. But by then, she was too sick for it to do her much good. 25 operations in 10 weeks, all free of charge, failed to save her. Nikki White died, aged 32. But she did not die from lupus. She died from lack of basic access to health care. T.R. Reid tells the story of Nikki White in his study of the American healthcare system, The Healing of America, in order to set up the fundamental question of his book. The bottom line he proposes is this: is affordable basic health care a human right, at least in wealthy countries, or is it a commercial commodity to be bought and sold for those with enough money? The question is powerful but inexact, for the fundamental issue at stake is not exactly affordable health care. Health care is merely the means to an end. The actual issue is health. Is health a basic human right, or a commodity to be bought by and sold to those wealthy enough to afford it? Even this way of putting it, though, remains imprecise, because in cases of potentially fatal disease, the issue is not simply health, it is life and death. The question that the American healthcare system really poses is this: is life a basic human right, or is it a commodity, like a car, a computer, or a camera, to be bought and sold to those who can afford it? Not a right for all, but a privilege for those who can pay for it, or fortunate and healthy enough to hold down a job that provides it. In his book, Reid repeatedly drives home one point: every developed country in the world, bar one, has faced the moral question and answered it in fundamentally the same way. Healthcare is not a commodity for the wealthy. It is a right for all. Basic healthcare is like education, like police and fire protection, like public libraries and state parks. It is like fair trial by one's peers, free speech, freedom of religion, and public assembly. Basic healthcare is a human right to be guaranteed to all. Everywhere else, that is, but America, the nation that gave rise to inalienable rights. Every developed country has reached this conclusion, along with a growing number of developing countries. That is, every country but one. One of the wealthiest countries in the world, the country with the world's best quality of health care, provided you can afford it. And you guessed it, that country is America. Here, alone among developed nations, healthcare has been a privilege reserved for those who can pay. Until now. This is no theoretical appeal to national pride, but a personal reality facing every American except the most wealthy. I spent most of my youth growing up overseas, while my parents served in the American division of an international NGO. In 1999, the same year as Nikki White, my mother was diagnosed with cancer. But unlike Nikki, we had the ironic good fortune to be living outside the United States. Our NGO considered shipping us back to America. My father resisted for one simple reason. With a pre-existing condition, my mother would be denied health coverage in America. So we stayed in Singapore, a newly developed nation, not quite as wealthy as the United States, yet one with a more developed sense of equity and justice. A country where my mother, although a foreigner, could be treated through the government health system at subsidized cost. It was not cheap, yet we could afford it. Cancer is always traumatic. But in my mother's case, the trauma was caused solely by the disease and the fear of death, not by the possibility that she would die untreated or that the treatment would bankrupt my family. So our country has just taken a giant step forward into the community of not only wealthy, but also moral, caring nations. Those countries not only prosperous enough to provide basic health care for all, but also equitable enough to do so. Is this new system flawless? Of course not. Politics, like life, rarely attains the ideal state. Is it the best that we can ever possibly achieve? Hopefully not. But let those who oppose the new healthcare legislation on whatever grounds ask themselves at this time of extended economic uncertainty, what if it were you who lost your job and your family's health insurance? What if it were your husband or your wife, your mother or father, your infant or child, who was dying from a curable disease that you could not afford to treat? And let those members of Congress who oppose the new healthcare legislation answer this. How do you justify denying your constituents guaranteed access to basic health care when their tax dollars provide just such a guarantee and an even more generous standard of health care for you and your family? If their government representatives should not ensure them access, why should their tax dollars ensure your access? If life without health insurance is too distant a possibility for you to imagine, ask those who grieve for Nikki White, or ask me, whose mother lives on due to the generosity of a foreign nation when my own country stood silent. America has just taken a giant step forward, a giant step not just economically, but also morally, a step that every other developed nation took before us, a step that removes a cause for national shame and international humiliation. Let us celebrate this long overdue step forward into sensibility, propriety, equity, and justice. Over the next few years, we will have ample opportunity to tweak the system, to improve it, to adapt it to changing realities or challenging circumstances. But let us take just a moment now to celebrate what our country, not any one political party, but our entire country, has finally attained. And let us try not to sink it for some momentary political advantage. Human lives are at stake, American lives, people you may know and love, people whose lives count, whether or not you or I know them and love them.